Good day, CIs. Today I will be performing the essential newborn care, and in this performance I will be performing the steps by phase. So let us start with the preparatory phase. First is to remove all jewelries. And then put on mask. Put on mask. Put on mask. Put on mask. And closed cap. So in this case I have no closed cap, so I'll be using my normal cap. And then wash hands using the procedure that WHO provided for us, which is the 11th step procedure. And next is prepare and arrange materials or supplies in linear sequence. Here's the sterile gloves. Here's the sterile gloves. Here's the sterile gloves. Dry linen. The bonnet. Syringe. Plastic clamps. Scissors. Instrument clamps. And 2 kidney basins. And then to separate, after breastfeeding, we have the eye ointment, stethoscope, vitamin K, and Hepa B and BCG vaccines, and cotton balls. So this is we're gonna separate this for a while later. This is for later. And then after that, you must prepare a clean newborn resuscitation area. So here is my area. And we'll check the equipment is clean, functional, within easy reach. So in this case, our equipment is just here, so it's just an easy reach. And after that, we have to don 2 pairs of sterile gloves. So the first glove is on now, and here comes the second glove. Then place a dry sterile linen on the mother's abdomen. So in this case, we'll be just using our friend, our our puppy friend for our mother. This dry linen is intended for the preparation for the drying of the baby after delivery. And then after that, we have to deliver the newborn applying the aseptic technique. And then after delivering, after delivering, we should call out the name and the sex of the baby. Call out the time and the sex of the baby. 12 time of delivery, 12 p.m. and baby is female. So this is in the preparatory phase. So after in the preparatory phase, which we have delivered the baby, we should proceed the first 30 seconds. Immediately and thoroughly dry the newborn using a dry and sterile gauze. And then wipe first the mouth, the nose, the head, the face, then the body, carefully not removing too much of the vernix caseosa, because the vernix caseosa is very essential to the baby, for it provides insulation and lubrication. And then we will assess the newborn using the AGPAR scoring tool within the minute after birth. So the results are: heart rate is over 100 beats per minute, so that is a score of 2. The respiratory effort, which is the baby elicited a strong cry, a loud cry, so the score is 2. The muscle tone, as you can see, the baby has well-flexed extremities, so that score will be given a 2. The reflex irritability, the baby elicited a vigorous cry, so that is a score of 2. The color of the baby is completely pink, so the score is 2. So the total score of the AGPAR is 10, which is a good score for the baby. And then after that, 1 to 3 minutes after the first 30 seconds of the time-bounded phase, we proceed to the first for the second 1 to 3 minutes. We should promote skin-to-skin contact between the newborn and the mother. We should remove the wet cloth. We should first remove the wet cloth and then place the baby on a prone position on the mother's abdomen or chest. And then cover the newborn with a dry blanket or a bonnet. And then we should reevaluate the newborn using the AGPAR scoring tool 5 minutes after birth. We should assess the newborn in a cephalocaudal manner from head to toe. So in the AGPAR scoring from the 5 minutes, the score was 8, but still it is a very good score for the newborn. After that, remove the soiled pair of gloves before handling the cord, the umbilical cord. Then now we proceed to the cord clamping. We We should properly time cord clamping and cutting. In this case, we just used this piece of fabric for the cord. Then first, is to palpate and wait for the cord to stop pulsating. We should not milk the cord. And then, we should clamp the cord using the forceps within the latex band. Two cm from the base of the cord, just about here. And then we should clamp again. We should clamp again 3 cm from the first cord. Just about here. And then after that, grab our scissors, and we cut the cord and place the latex band correctly on the cord. The latex band. After that, we should check for the presence of the one umbilical vein, two umbilical arteries, and then if there is any bleeding near the base of the cord. So there is no bleeding in the base of the cord, and there are certainly one umbilical vein and two umbilical arteries. And so that's it for the time-bounded phase. So after performing the time-bounded procedures, we proceed now to the non-time-bounded procedures. First is to administer Creed's prophylaxis. We should open the eye of one eye by gently holding the upper lid toward the index finger, the lower lid down with the thumb, and squeeze eye ointment gently to deposit about 1 cm of eye medication on the lower lid. And we should apply the drug or the ointment in the inner to outer canthus. And then the other eye, inner to outer canthus. And then after administering Creed's prophylaxis, you should place an ID band bearing the name of the baby and the mother. We have the choice to put it either on the wrist or at the ankle. So I'll put it at the wrist. Then after the band, you should measure the newborn's body length, head and chest circumference, using the tape measure. It's measuring the length, measuring the head, measuring chest circumference. And then after measuring, you should take the baseline core temperature of the newborn. After taking the temperature, you should check for the anal patency, carefully inserting an NG tube, an NGT tube into the anus while positioning the newborn appropriately. And then after that, we proceed to our weighing scale. So first, you must line the weighing scale with diaper to take the newborn's weight. And we should always be careful when placing the newborn on the weighing scale. Then we should do a thorough physical exam. After that, you must prepare and inject vitamin K IM into the left vastus lateralis muscle. And the dose is depending on the weight of the newborn. After vitamin K, you should also inject the Hepa B. Here is the vitamin K on the left vastus lateralis muscle, and then in the right is the Hepa B, the right vastus lateralis muscle. And then after that, we put on the baby's clothing. And then we should wrap the baby. Then after that, we do aftercare of the materials and equipments. That is our essential newborn care. Bye bye. Thank you, miss.